Hey, welcome everyone to tuberculosis. So, what are the pathophysiology of tuberculosis though? So, the pathophysiology is usually acid-fast bacilli spread through coughing and creating caseating granuloma. Okay, acid-fast bacilli that create caseating granuloma. So, it's a granuloma, so it's something serious. So, how do you find it? It could be asymptomatic screen or first exposure could cause a pneumonia, which is cough and a fever. Cough sometimes could cause, if there's a reactivation, could cause hemoptysis, weight loss, and gone complex. What are the risk factors though? What are the risk factors? Risk factors: homeless, foreign travel, and being in a prison. How do you diagnose it? Asymptomatic screen usually. Let's see, how do you diagnose it? This is the when it gets very interesting. So asymptomatic screen, PPD or interferon. So this is how you diagnose it. PPD, what is it? If it's 5 mm immunocompromised, or it could be 10 mm in health care workers. It could be 15 mm in soccer moms, which means people are very healthy. 15 mm, they have 15 mm. This is TB. Or it could be interferon, either positive or negative. If it's positive, then there's TB. Negative, no TB. Or it could be chest X-ray. You could find cavitary lesion, meaning granuloma, or it could be acid-fast bacilli smears plus isolation. How do you treat it? You treat it if acid-fast bacilli positive, then you give the right medication, which is rifampin, isoniazid, pyrazinamide, and ethambutol. But if acid-fast bacilli negative but chest X-ray positive, then it's isoniazid plus B6. What if it is acid-fast bacilli negative and chest X-ray negative? Then the same thing, you do isoniazid plus B6. And what do you do in follow-up? Follow-up, so you ignore BCG vaccine. Always pick interferon if it asks you to choose. Not beta, gamma interferon. And never PPD if the PPD was positive. And if the acid-fast bacilli positive, but weeks later turns out to be Mycobacterium avium complex, treat as a Mycobacterium avium complex. If acid-fast bacilli positive, but then it happened to be Mycobacterium avium complex, then treat as Mycobacterium avium complex. Now, the side effect of medications: rifampin causes red body fluid. INH, isoniazid, could cause B6 deficiency, that's why we give it with it. Could cause a neuropathy, always give B6 with it. Pyrazinamide causes hyperuricemia. Ethambutol causes eye color, vision disturbances. So this is the side effect of medication. So TB, in a summary, in a nutshell, it's usually associated by acid-fast bacilli organism, causes fever, cough, hemoptysis, weight loss, risk factor homeless, foreign prison. Asymptomatic screen 5 mm in immunocompromised, 10 mm in healthcare worker, 15 mm in healthy people. You could find chest x-ray cavitary lesion. Okay, so how do you treat it? If acid-fast bacilli positive, then you give rifampin, isoniazid, pyrazinamide, ethambutol. If acid-fast bacilli negative but chest x-ray positive, you give isoniazid only for 9 months plus week 6. If both negative and symptoms, if both negative but still like you could suspect there are symptoms, then you confirm it in other ways, then you can do isoniazid at B6. Follow up, you can follow up with acid-fast bacilli or interferon. The side effect, rifampin causes red body fluid, INH causes B6 deficiency, pyrazinamide hyperuricemia, ethambutol causes eye color and vision disturbances. And that is the TB summary. Thank you so much for listening.